to be looking at only my screen. Well, let's start anyway. Yes, so the topic of the conference is about representation hungry. Let me see if this, does it also work now when I go to the next slide? Now we go.
Maybe you have to share to full screen mode first, and then
the presentation mode.
Yes,
yeah. Perfect. Okay.
Sorry. Right. So the topic is: are psychopathological phenomena representation hungry? And to already give away right away, sort of what's my take on it. I think that. I do think that an active account, I'm particularly focusing on an active account as a variety of the embodied cognition account. I do think we need to scale up an active accounts that as they are, and the kind of view of cognition that they present now is not enough to account for the complete range of human cognition. But at the same time, I do not think this requires us to switch to a representational model. I think this still is very much within the realm of an active and embodied accounts. So that's in a nutshell, so to say, what I want to say. I will say first something about why an active approach to psychiatry would be appealing. I'll say something about representational versus enactive models of cognition, and then I'll say something more about the notion of existential sense making that I think is lacking in an active model so far, but is necessary to make sense of not just psychiatric problems, but basically human cognition in general. So, and then I end by addressing this question: does existential sense making require a representational model? You already know what I'm going to say there, but I'll try to give some more arguments and reasons for you to hopefully at least somewhat agree with me. Right, so why an active approach to psychiatry? This is actually a point where it's very tempting to go into Sean's talk, but I'm just going to shortly say something about it and say that if you want a holistic model of psychiatric disorders in order to do justice to their complexity, holism often has this connotation of being vague. And I think what an activism has to offer is making holism, having a non-vague holistic model, so to say. In particular, I think it can help answer what I call the integration problem. So how to integrate these very diverse heterogeneous factors ranging from genetic, neurobiological, social, existential, that may all play a role in the development and persistence of psychiatric disorders. Exactly the point that Sean also referred to. So how to integrate that and what kind of story to tell about their causal interactions. And in fact, I think what you're basically asking for, if you want to understand how these things go together, how they affect each other, you're asking also about what's then the nature of psychiatric disorders. What do you see as more fundamental or less fundamental? What do you see as mental in mental illness? So a very short remark about what I think should be integrated. So to say, what are the dimensions or factors that are relevant here? That would be, first of all, people's experiences, their physiological processes. This is very broad, ranging from genes to neurobiology to hormonal processes, the social-cultural dimension and the existential dimension. And with the existential dimension, I mean the fact that people can relate to what happens to them. So we do not just experience things, but we also can take a stance on what's happening to us. And especially in psychiatric disorders, this can be a very relevant, so to say, feedback loop in terms of you can be so ashamed as not to seek help, for instance, or you can develop such a fear for getting another panic attack that you actually perpetuate the problem by your fear of the fear. That's the kind of thing that I mean with the existential processes or dimensions. Now, in this talk today, I'll mostly focus on this aspect as I think it's most pertinent to the research, to the question of the conference. But it, of course, hangs together, as we will see. Now, there are many, many models of psychiatry around. I won't discuss them, but I just want to say something. I just want to at least say, why would there even be interest in having yet another model? Why would an enactive approach do any better? Why would we have any reasons to believe that it would be interesting to add yet another model? And I think this is where the ontological question comes in, namely that enactivism offers a specific perspective on what the mind is, and particularly how it's related to the body and the world. And I think this perspective really helps to solve psychiatry's integration problem in a way that these other models can't. In particular, when you look at many of the models in psychiatry, many of them are what you could call representational models. So if we look at the way in which the mind is portrayed, or better actually, in the way in which the relation between mind, body, and world is portrayed, you get something like there's this outside world, we have an inner mind, and in this inner mind, we manipulate or use typically representational model of this outside world. And if you depart from such a mind-world topology, as Dreyfus and Taylor really nicely call it, it's very logical to think, okay, oh no, sorry, before I get into that, another way to make this similar point is to say, what Susan Hurley said, these are all models that you could call sandwich models of the mind. So we have the input and perception, we have some cognitive processing going on, that's the juicy meat bit, and then we have the output in the world, the action. Now, if you follow this kind of mind-world topology, it makes sense to think that what's going wrong in psychiatric disorders has to do with this patient's inner modeling of the outer world. There's nothing wrong with the input to their senses. There's nothing wrong with their sensory organs or something. There's nothing wrong with their output. Something must be going on this cognition level, so to say. And as you can see, this very much fits, or this, yeah, nicely fits, you could say, with a neuroreductionist kind of psychiatric disorder, because if there's one place where we would locate the mind in this model, it would be in the head, in the brain. The big disadvantage of this kind of mind-world topology is that it's a very narrow, internal, and individualist conception. Now, an enactive account has a very different type of ontology. And maybe it's good at this point, we just talked about the pragmatic take of Sean. I do think that actually pragmatic considerations are typically inspired by at least implicit ontologies, that they sort of work through our pragmatic decisions that we take. So enactive cognition, and now I also need to say something about how that looks, which is much more difficult. Enactivism offers a different mind-world topology. And I did try to make, with my very limited PowerPoint skills, to make a picture trying to say that the capacity for the mind, so to say, the capacity to make sense of things refers, so the mind refers to the capacity of a bodily person interacting with its environment. So the mind, if you put it like that, this person's mind depends on the whole configuration. So it's not just in the head, it's, if you could say it's sort of an emergent feature of this person interacting, bodily person interacting with their world. The notion that an activist use in order to describe cognition or the mind is sense-making. And they say cognition is fundamentally embodied and embedded sense-making of our environment. So let me say something about how this sense-making gets understood. First of all, from an active perspective, sense-making is essential to living. This is basically the life-mind continuity thesis as developed by Evan Thompson and Ezekiel Lee Paulo, amongst others. And it says that if you have a living organism, it is dependent upon exchange with its environment. And because this dependence, it needs to make sense of this environment. It needs to be able to discern, distinguish food from non-food, danger from non-danger. It needs to have some form of basic sense-making of its surroundings. This makes it necessarily embodied and embedded. It's the specific organism's bodies with its specific needs and vulnerabilities that make some aspects of the environment relevant, and it always depends on the environment for its own continued existence. That's what characterizes living beings, according to the enactive theory. Because it depends on the environment, this environment is not just a neutral collection of objects. It has its valence, so to say. So some elements of the environment are more relevant to the organism than others. So there are some sort of basic, what you could call metabolic values implied because of the organism's precarious specific bodily nature. And then sense-making is also affective. This is a point that has especially been fleshed out by Giovanna Colombetti in many of her work, and where she says sense-making is first and foremost a bodily affective evaluation. And I think you could say I think you can say affects are sort of the felt counterparts of these metabolic values. It's some things attract us, something repulse us, and this is directly related to the kind of relevance it has for us. Right. So if we look at this capacity for sense-making, we can already see that it requires a living being interacting with its environment, which means that from an enactive perspective, there can be no body, there can be no physiological processes without there also being a mind and without there being interactions with an environment. And on the other hand, there can be no mind without a body that's dependent upon the environment, interactions with the environment. So if we want to understand cognition or sense-making, we should, from an active perspective again, look at the whole system, so to say. So we should look at the interactions of bodily beings with their environments. Now, so when we talk about the mind, body, and world are automatically included. That's about saying the same thing. So if we come back to this idea of applying an activism to psychiatry, we could say, okay, we can see psychiatric disorders as disorders of sense-making. There's a lot more to be said about this, but that will take much too long. I'd be happy to talk about it in the discussion, but for now, I'll just say, let's define psychiatric disorders as such. However, if we look at the integration problem, I think the sense-making, as I've introduced it so far, is not yet enough to properly tackle the integration problem. In particular, I think the social-cultural dimension and the existential dimension are not yet fleshed out enough, elaborated on enough. In a sense, I think we need I think we need to distinguish between the kind of basic sense making that's relevant to all living beings and existential sense making that at least we human beings do. So I just showed this picture, this kind of cute picture of the squirrel and the owl. Now I think as a model of sense making, maybe we can still relate to this. We can, especially if we apply some anthropomorphic tendencies, and we can say, oh, the squirrel is surprised and the owl is mildly amused or interested in trying to judge what's happening here. But it gets much more difficult to relate when we're talking about bacteria who swim up to a sugar crystal, or when we talk about trees communicating through the wood wide web. Yet these are all cases of sense making, but they do seem quite different from the kind of human sense making in this social cultural practices of ours. It does seem to be that we do something different here, which is, I think, where the whole notion of scaling up and representation hunger refers to. Something different seems to be going on with us here talking in a conference than with bacteria swimming up as sugar ingredient. So I would suggest that apart from these characteristics of sense making that I just explained, sense making can also be reflexive. It can also be existential sense making, and there's a difference there. It's a different type of sense making. In particular, where you can say that the organism interacts with the environment, directly interacts with an environment that's relevant for it and valence for it. Human persons can also relate to their interactions with the world, can relate to themselves, can relate to others, can relate to their situation. So there is, so to say, there's an extra, well, I wouldn't like to say level, but let's say reflexivity involved. This is maybe also the point at which to say I talk of humans and persons, the whole question of whether animals are capable of this kind of existential sense making is just something I won't go into. I think it's an empirical question, but given that we are interested in psychiatry and in human beings, I just use person, so to say, as a shorthand for existential beings. Now, as soon as you can relate to the world in this sort of reflexive way, so in this stance-taking way, a lot of things change. I think basically you can say it changes everything. We move from an organism environment system to a person in their social-cultural world system. And there's no longer only metabolic values that guide our behavior, but what we could call existential values. Even more so, these existential values can even override our biological, so to say, or metabolic values. I mean, we can refrain from eating even though we're hungry, for instance, when we're fasting out of religious reasons or social reasons. And a lot of the sort of biological functions get transformed. So for us, eating, having sex, defecating are all much, are not just, let's say, are not just biological acts. And maybe a way to make this a little bit more tangible is by looking at this picture. So the picture is called "Why Your Dog is Happier Than You." And we can see a dog that's immersed in their immediate situation, whereas the human being is thinking of all kinds of things rather than actually looking at the trees and at the sun in front of them. When you are able to relate to what happens to you, I think this opens up a whole new range of what you could call different ways of being in the world. You obtain a degree of freedom, you obtain a degree of choice, and with that, morality and meaning come into play. in a way in which a change is made from caring about staying alive, like all organisms do, to caring about leading a good life or a dignified life. Yes, I think this sort of changes everything. This changes everything. Now, to just sort of summarize, where basic sense making is direct, immersed sense making, existential sense making can refer to sort of like the reflection or deliberate stance taking. But I want to say that once we have this capacity for explicit reflection and deliberate stance taking, all of our sense making gets existentialized, so to say. So even our direct and immersed sense making is different because we are part of a world imbued with meaning and value, and we cannot escape that. For instance, we cannot escape to express things by what we wear, even if it's just, I don't care about what I wear. I just took anything out of the closet that was in front of me. The fact that we don't simply have a fur that we don't think about, but we have to make choices, means that what we eat, whom we eat with, how we dress, all these kinds of things are meaningful in a way that cannot be escaped. Yet this is very much immediate and direct in the sense that I do not have to think about it or reflect about it. So even complicated social situations, I have a sense of what is and isn't appropriate in a specific setting. It depends, of course, on the cultural context, but even coming from a different context, even I could understand that even if I'm hungry and I see these nice apples that these women are carrying around, and even though they look nice and I'm hungry, I still understand that it wouldn't be a good idea to try and grab an apple from over there, because I'm aware that this is probably some sort of ceremony that I'm unaware of. Yes, so it is direct and immersed, but very much characterized by our existential stance-taking capacities. Now, if you look at the development of this existential sense-making, the first thing to note is that I talk as if existential sense-making is one thing, but I think you could better think of it as it consisting of a set of capacities, a family of capacities. This is also, again, where the relation to other animals comes in, that other animals may also have some of these capacities that make up this set or family of capacities. And importantly for our discussion here, this stance-taking is very much something that is practiced in and through bodily social interactions in specific social-cultural practices. I realize that it's a long sentence, but yes, to look at the examples, so take the example of peekaboo, for instance, or hide and seek. This is a very embodied and social way in which infants learn what it means to be visible from a certain perspective. Or take the example of children that are fighting, and you would say to the one child, how would you feel if she would do that to you? So you're practicing stance-taking with your child, or you're practicing even sort of explicit deliberation. Go sit and think about what you did to your little brother. In these ways, we are sort of we are training what I would say the stance-taking capacities of our children in these very specific social settings. Now, I think that it's a gradual development. There's this set of capacities, and at different ages, people are capable of different types of capacities. Yet I do think at some point we can speak of a qualitative difference between this basic and this existential sense making. And one way I think to make this more tangible is to think about when we hold someone accountable for something or not. Now, this is my 15-month-old daughter, Ida, who has recently discovered the joys of throwing food on the floor. Now, she knows she isn't allowed to do that, yet she still enjoys it. And the interesting thing, I think, from a theoretical perspective is how can you as a parent at some point, I mean, when she was a baby, she couldn't do much on purpose. Certainly not when she threw something on the ground, it wouldn't be on purpose. But there is a moment in which you think you're doing this on purpose and you know you can't do it. Interestingly also, is that often when she does something that she's not allowed to do, she will shake her head, no, 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 while doing it. Obviously, this is still very different from an 8-year-old throwing food on the floor. But by holding her accountable, so to say, we are making her an accountable person, you could say. So she would here be very tempted to make a mark and leave a mark on the world and on the floor. And then I say to her, no, no, you know that's not allowed. Don't you have to put the food in your mouth? And this time she actually listens to me, which often also she doesn't. But I think this notion of holding someone accountable is, I think, very helpful to get an idea of this, that we're talking about something gradual, yet something qualitatively fundamental, qualitative thing, in the sense that you expect different things from a 3-year-old or 8-year-old or a 15-year-old compared to a normal adult, I would say. And of course, then there's also other reasons why you wouldn't hold someone accountable. So for instance, when someone is experiencing an acute psychotic episode or a very severe depression. Right. Now, if we come back to this integration problem, I think these 4 dimensions from an enactive perspective, they are fundamentally related. And I would say that none of these 4 dimensions can be understood in isolation from the other 3. This is the point where it would be very tempting to, again, address some of the same issues that Sean did. But this would require a whole very specific explanation of the kind of causality involved in moving from linear to organizational causality and so on. And there's just no room for that in this talk. So too bad, I have to just leave it at this and maybe talk about this a bit more in the discussion. Now, to come back to the question that this conference is all about. So if we do think that there is this kind of thing as existential sense making, doesn't that require us to switch to a representational model? Because we're talking about taking a stance, reflecting, things like imagination are part of it, language, remembering, and all these kinds of things are capacities that involve or could involve some representations. And now the question is, do these capacities to represent, or does the capacity to represent require also a representational mechanism? This was exactly the point, the question that was raised in reaction to Adrian's talk earlier, difference between the product, so to say, and the process. Now, I don't see any reason why we should. So the representation-hungry problems, as Clark and Toribio so nicely called them, they mainly refer to absent and abstract phenomena. And you can see why it's attractive to have a representational model here. You can easily deal with that because you think, okay, even if it's absent or even if it's abstract, I have the representation. I still have the representation that I can, how do you say, that I can deal with, that I can base these things on. my remembering of things, for instance. So that seems a clear advantage to be dealing with these kinds of cases from a representational perspective. But I also want to bring into mind that there are several important downsides to adopting a representational model. It would bring you back to this whole inner mind, outer world topology, which leaves you with a gap between mind and world that will always give the representational anxiety. Am I actually representing the real world out there, or is there a mapping problem maybe? And how could I be aware of that? And even more on a more general level speaking, as soon as you separate vehicle and content, or matter and form, you always come up with the problem of their relation and also their causal relation. I had to think of this book by Susan Oyama, The Ontogeny of Information. It's a wonderful book where she describes the information processing metaphor in DNA research. And she just goes into the very details of what do we mean when we say that a specific gene codes certain information, and what does actually happen at the biological level. And I think that when you look up close in that kind of way, representational models become much less attractive, because there is this whole thing of how to bring these vehicle and content, or matter and form, how to bring them together, but also who is doing the representing, who is doing the choosing. I think something that may also be very helpful when you feel a representational urge coming up is to switch sensory examples, so to say, sensory mode. I think when we think of representational models, it's often visual examples that we think of. So we think of the pictures in our photo book, and we think that somehow we have stored these pictures or whatever in our mind in some sort of filling cabinet. But if you switch sensory mode and think, for instance, how would that be with sounds, or how would that be with smell? Then already I think that sort of shows that there are some very specific problems with where does the one sound begin and the other end, and how do you know which sound to look into? Well, all these kinds of difficulties. But maybe on an even more philosophical level, in which representational models are, I think, unattractive, is a very sort of simple thought, actually, that John Heil makes in his 1981 paper, Does Cognitive Psychology Rest on a Mistake? He discusses the work of Fodor there and cognitive psychology. And he says the meaning of a sign is not something intrinsic to the sign. I mean, that's the whole point of representations, right? But if you look at it, then actually the use of, or the application of a representation, when we look at what representations are in our everyday world, they require agents in specific social cultural practices. In fact, they require the kind of context that is specifically not a representational type of, not to be formulated in a representational model. Now, there is much said about representations and representation hunger, but I do want to highlight some work that I think might be helpful from this enactive perspective. And one is a paper by Degenaar and Mijn, where they say that the fact that there may be cognitive phenomena which involve the absent or the abstract, it doesn't necessitate representations because they involve the absent and the abstract. Instead, they say, we are going through the same motions as when we are engaged with concrete present objects in our environment, at least partially. And this going through the same motions is also cashed out by work of Nigel Thomas, who works mostly on mental imagery. And he says, imagining and remembering are partial reenactments of the same perceptual acts that would be carried out if one were actually perceiving. No need to assume any kind of representational model. And he gives the example of the fact that people make spontaneous, unconscious, that should be saccadic, eye movements. And in the case of a visual stimulus and in the case of a visual image that you have in your mind, people make the same kind of, the same pattern, so to say, of these saccadic eye movements. And interestingly enough, if you disrupt these movements, the visual image gets disrupted too. There's even a suggestion that this might explain the effectiveness of EMDR therapy. This is the trauma therapy in which patients are asked to remember their traumatic experience or picture it, and then have to watch something going from the left to the right. And so to say, the idea is that the memory then becomes less sort of emotionally salient. And this actually seems to work very well. So to sum up, the point that Degenaar and Mijn also made, Kieferstein and Rietveld say, reenactments of non-representational processes do not become internal representations just by virtue of being reenactments. I think that sort of summarizes the inactive idea of why there's no need to switch model. So to conclude, I do think that if we want to understand a phenomena like psychiatric disorders, enactivism needs to include existential sense making. And once we do that, I think we can both allow for a certain discontinuity. So we can say, indeed, there is a difference between what bacteria do and the kind of sense making that we do and the kind of capacities that we have. Yet there is also a continuity in how these capacities are organized. We're still talking about embodied, embedded capacities here. So rather than speak of a cognitive gap, as it's called, I think you could rather speak of sort of an existential transformation to a different structure of behavior, as Merleau-Ponty calls it, or to a different form of life, as Wittgenstein calls it. That was it. Thanks for your attention.
Thank you, Sanneke. Nice talk. New perspective.